I'm gonna have to copy the URL that you sent out to the new one.
He was trying to go through YouTube, and he had to work on how he switched over to. He does not. I don't know enough to look up how to do everything is on you. And it involves the government. Don't go over there. You'll watch it like here.
I'm still not seeing.
I know. Can't hold me accountable.
I'm sorry, I'm actually having super technical.
No, okay.
So I'm going to send the link. I'll send you the link. I have a new stream link.
The better question is what I get in trouble for. Hey, now
Sorry? I don't know. I'm having some problems. No, thank you. Is that the current one? Yeah, but the current one is not copy pasting because it's not letting me go live. It's not letting me communicate at all. Yeah, but you can't put no, because it's saying you are not the person, even though I am. So it's saying, so you want to let you chat? Yeah. No, I can't. The old one won't let me, I am. For some reason it's saying you're not authorized. So no one's going to be watching this. So I sent it to Gabby and said, can you send this link out? I'm going to call her and let her know. I don't know what's going on, but hey, did you bring your microphone 10 minutes before the go? Yes. I sent the new link out to Gabby, and I'm calling her right now.
Okay.
Not I can send them all. Hang on to that. Do you think Gabby, do you know if Gabby's upstairs? All right. Hello.
One second, please.
Yes.
Testing. Testing.
There we go.
Hello. Wow, look at you all. Thank you so much for coming today. I think we let you know about this event yesterday, and so I really appreciate you providing some time to come and listen to Governor Polis. We're so honored and happy to have you, Governor Polis. I want to tell you all a little bit about the governor. I'm sure that you know a lot about him already, but he just has had such a wonderful and varied career path. So he started out as an entrepreneur, an education leader, public servant, and the governor is a Colorado native. After launching several successful companies, he founded schools for at-risk students, including one in my neck of the woods in Eagle County, including for new immigrants, and started nonprofits to help veterans and entrepreneurs. He's held other offices, serving on the State Board of Education and as a member of Congress. When Governor Polis assumed office as Governor of Colorado, I know many here were thrilled to have an ally in environmental sustainability. Governor Polis's record and commitment to reversing the effects of global warming, for example, is heartening. It's time we use emerging facts and science to protect Coloradans and the environment we love and cherish so much. Others here are eager and ready to help the governor save Coloradans money on health care. After expanding access to health insurance in Colorado through the state exchange, tackling cost is our next frontier. Like the governor, I believe that access to affordable quality health care is a human right. We here at the department know that the most effective way to reduce costs is through prevention, as well as addressing inequities and the social determinants of health. That's why the governor's commitment to full-day kindergarten isn't lost on our department. We know that when children have access to early childhood education, they go on to lead healthier lives. When I was a county commissioner, I was proud to work with Congressman Jared Polis on many of these issues. Now I'm even prouder to have him as my governor, and together with all of you, we're going to set our goals high and pursue them with boldness. It's my pleasure to welcome Governor Jared Polis.
Well, hello, everybody. It is great to be here at the Colorado Department of Public Health and Environment. First, I want to take a moment to thank each of you for your great work for our state. Any team is only as good as its members. When I started companies, we were only able to bring successful products to market and grow because of the men and women that helped develop our companies and the talented workforce we have. And our state is only as good as the men and women that spend every day working to provide public good to others across our state. And in your agency, the work you do on keeping people safe, handling environmental disasters, protecting our air quality, having good data that helps drive decision-making is absolutely critical to protecting our Colorado way of life, our health, the health of our families. And I want to thank you for your work every day as important parts of Team Colorado. So give yourselves a round of applause. As Jill mentioned, saving people money on healthcare is one of my administration's top goals. And your agency, in many ways, is charged with many of the critical aspects around behavioral health, around social determinants of health that can really move the bar, whether it's access to healthy food and diet and nutrition, whether it's the quality of the air we breathe and reducing asthma rates and cancer rates, whether it's acting on climate change, which has so many profound health and economic effects. Your agency is front and foremost in helping to protect the quality of life for Coloradans, protect our health, protect our safety. We have a number of areas that we're excited about the opportunity to work with the Colorado Department of Public Health and Environment to make progress on. And I think that we together can make that difference. Some of those areas are through legislation that's currently being pursued. Others are with existing authority of the agency to really be one of the lead agencies in a comprehensive approach to climate in Colorado, helping us achieve our goal of 100% renewable energy by 2040. Cleaning our air quality. As you know, we've had ozone non-attainment and we've had worse air quality on some days than even Beijing in the Denver metro area. It's also a problem in other areas of the state. And we need to take action that will directly result in improved health outcomes for individuals in Colorado, also translating to saving people money on healthcare. One of the things, as we think about saving people money on healthcare, it's not just about the person who's afflicted with a condition, because What we do through the insurance model is we all have to pay more for sick Coloradans. And that's why this is an important case to make to the very healthiest Coloradans, that you are paying more on healthcare because other Coloradans aren't living a healthy lifestyle, aren't eating well, aren't exercising. So we all have an important role in bringing down healthcare costs. And there's something in it, even for the very healthiest Coloradans, because guess what? They're paying for their own insurance too. And all those costs are reflected for them. It's one of the things we talk about, not one of the direct areas of the purview of this agency, but prescription drugs. While you're not the state experts on that, I think you all know we pay too much on prescription drugs in this country. You know that as consumers, if you've ever had to deal with it, but you also know that even if you haven't had any prescription drugs and you've been fortunate in your life and you haven't in the last decade had to take any antibiotics or anything else, you're still paying for the cost because those are reflected in your insurance. And even employer-based insurance, which we have at the state, and we negotiate through our personnel administration department, and we're hoping to deliver better healthcare benefits for you. But we all pay too much. If we were able to reduce the cost of prescription drugs, we could improve those benefits with lower out-of-pocket, lower deductibles, lower costs, see more of your paycheck, all of those great benefits that can ensue from saving people money on healthcare. So we're excited to be working on that in a comprehensive way. We're also focused on early childhood education, which from your agency's perspective, we talk about the health, nutrition benefits of early childhood education. More kids in kindergarten. For kids from low-income backgrounds, that might be the only healthy meal they get a day. Might be 2 meals, breakfast and lunch. If they're only going half day, they might not be getting a lunch. More kids in preschool through the Colorado preschool program. Also having the ability not just for the diet and nutrition, but the interface with the families at the school level around healthy lifestyles, and making sure that we can improve exercise and diet and nutrition from a young age to build those healthy habits for our young learners. So I'm here to listen to you and learn from you. This is kind of one of these open town halls. I want to do these. Again, I'm trying to get out to all of our great agencies and meet as many of our wonderful Team Colorado members as I can. Thank you. We're working, as you know, to provide you more benefits and help you where we can. Obviously, renegotiating the healthcare plan. We're trying to work on a family leave, a paid family leave for young parents, which we hope to deliver soon. That's our request into the legislature. We are working on other benefits wherever we can. And of course, we know that your commitment to the state is what makes our work, our state tick. Regardless of who the governor is, regardless of who the legislature is, the important work that you do continues. It goes on. We all kind of add our imprint to it from the political side, but the work you do is science-based. It's important. We got your back. We want to empower you to help make Coloradans even healthier and save people money on healthcare. Thank you. So Jessica has a mic. You can roving mic. Okay. Okay, just raise your hand. Any topics doesn't have to